Hey everybody. I know some of you are wondering about the update since Jade's orthopedic appointment, and I figured I would just make this video because it's a little easier to explain than to type out. So yesterday we went to her orthopedic appointment and it went a little bit differently than we had expected. We thought, worst case scenario, that Jade would have to have surgery and then would have to be in what's called the Dysplasia cast, which is like a half body cast for 6 weeks. That's what we had anticipated. After going to the doctor yesterday and after looking at the x-rays, the doctor let us know that she does have to have surgery, but it's a little bit more intense than what we had expected. So Jade has severe hip dysplasia, which basically means her hips are up much higher than her hip joints. They're not sure if she was born with her hips out of socket or if her sockets were just too shallow and then her hips eventually like drifted out and then drifted up. But for whatever reason, her hips are out of socket, way out of socket. So the doctor let us know that it was going to be hip surgery, what's called an open reduction hip surgery. And then she also said that they want to do, it's likely that she'll have to have each of her femur bones shortened because her hips have been out of socket for so long. There are things that are tight that shouldn't be tight, and there are things that are loose, like muscles and tendons that are loose that shouldn't be. So the doctor's afraid that if she pops those hips back in during surgery, that it's going to put too much pressure on that joint, and then that can cause issues. So she said it could be that she gets in there and things are looser than she thought and she can pop it in, but it's likely that because the bones have been out of her hip sockets for so long that they'll have to shorten the femurs, which basically means they cut like a chunk out of the femur and then they use plates and screws to put it back together. She also said that because this is such a big surgery, that instead of doing like one hip surgery, she's going to have to do one hip at one time and then the other hip 3 weeks later. So instead of being in that that Dysplasia cast for 6 weeks, Jade has to be in that Dysplasia cast for 12 weeks. So it's a lot more than we had thought it was going to be. So we're just trying to wrap our heads around that right now and figure out the best way to prepare ourselves for that. Yeah. So that's what we're looking at for now. It wasn't the news that we were hoping for, but we'll get through it, and hopefully it won't be too long before Jade's walking, and hopefully it'll be all worth it in the end. It's a lot. It's a lot to take in. It's a lot to think about. It's a lot to plan for. There are so many things that are going on in my head, and I'm a little bit disappointed. Because we have been doing physical therapy for so long, and we've been working hard to get her to sit up and just doing all this stuff, and now it's like, yep, back to square one, and we're gonna have to do this all over. But I think we're hopeful that after this it will be better. So we'll keep you updated on when the surgery is, and yeah. So thank you all for your love and your thoughts and your prayers and your support, and I am gonna kind of vlog about our journey through this and our journey through Jade's stuff and our family stuff. So if you're interested and you want to watch, it'll be on my YouTube channel. Or if you know any other families that might have kids that are going through some developmental delay or disability diagnosis, please let them know, because we're just a tight little family, and I it's hard, and I think the more people I can connect with, or the more people that you can connect with when you're going through this, the easier it is. So yeah, thanks again.